Good afternoon, Andrew Roseberg. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning, Mihiraa. I'm Andrew Roseberg, one of the nurses here on the surgical ward. I've just come by this morning to check on your progress following your gallbladder removal yesterday and to have a chat about your aftercare and what to expect during your recovery at home. Well, I can see you're looking a little uncomfortable this morning. How are you feeling right now? Please tell me in your own words what's been happening since yesterday.
Oh, good morning, Andrew. Honestly, I'm feeling a bit rough. My tummy is sore, and I feel a bit queasy, especially when I move. I also have this strange ache in my shoulder, which is quite annoying. I'm just so tired as well.
I'm really sorry to hear you're feeling that way, Mihiraa. It's completely understandable to feel some discomfort after surgery. First, I want to reassure you that your surgery went very well, without any complications, which is excellent news. Now, regarding how you're feeling, it's quite normal to experience some pain and tiredness after this type of procedure. The abdominal soreness you mentioned is expected as your body begins to heal. Also, that strange ache in your shoulder is a very common side effect after laparoscopic surgery. It's due to the gas used to inflate your abdomen during the procedure, which can sometimes irritate your diaphragm. This discomfort usually settles down within a day or two.
Well, the pain medication does help, but it's not completely gone. The shoulder pain is just so odd. I'm glad to hear it's normal, though. I was a bit worried about that.
I'm really sorry to hear you're feeling that way, Mihiraa. It's completely understandable to feel some discomfort after surgery. First, I want to reassure you that your surgery went very well, without any complications, which is excellent news. Now, regarding how you're feeling, it's quite normal to experience some pain and tiredness after this type of procedure. The abdominal soreness you mentioned is expected as your body begins to heal. Also, that strange ache in your shoulder is a very common side effect after laparoscopic surgery. It's due to the gas used to inflate your abdomen during the procedure, which can sometimes irritate your diaphragm. This discomfort usually settles down within a day or two.
Good to know. I'll definitely keep that in mind.
Exactly, Mihiraa. Lean proteins and plenty of fresh produce are excellent choices. Next, it's important for you to know when to seek medical help once you're at home. You should contact your doctor or come back to the hospital if you experience a fever, if your pain starts to worsen rather than improve, or if you notice any signs of infection around your incision sites, such as redness, swelling, increased pain, or any discharge. These would indicate that something might not be quite right. Are there any other concerns or questions that have come to mind about your recovery so far?
No, I think that covers it. I'll definitely watch out for those signs. My main worry was probably the pain and the shoulder thing, but you've explained that well.
That's good to hear, Mihiraa. Finally, let's go over some practical aspects of your post-operative care. Your stitches are dissolvable, which means they will disappear on their own within about 2 weeks, so there's no need for them to be removed. As for your dressings, they can usually be removed in 3 to 4 days, and you can then shower normally. Just gently pat the area dry. Before you leave, I also need to confirm your discharge arrangements. Do you have someone who will be accompanying you home today? It's very important that you are accompanied and that you have a carer at home for at least the first 24 hours after discharge, as you'll still be recovering from the anesthesia and surgery.
Oh, I didn't realize the stitches dissolve. That's good. My husband is coming to pick me up, and he'll be home with me for the next few days, so that's all sorted.
Excellent, Mihiraa. It sounds like you have good support at home, which is wonderful. Just to recap, we've discussed your progress, what to expect with recovery, activity, and dietary guidelines, when to seek help, and your post-operative care and discharge plans. Do you have any final questions for me?
No, Andrew, I think you've covered everything really clearly. Thank you so much for taking the time.
You're most welcome, Mihiraa. It was my pleasure.